Hey, Eric. What I wanted to do here was give you the way I do the analogy for what A2M, how it works, and why it's so effective when incorporated in my regenerative medicine protocol. So, what A2M is, it's a way to put out the fire in the joint that is arthritis before putting that amazing stem cell in there. So I like to use an analogy here of a garden. Okay, so let's pretend that the joint that we're dealing with here, whether it's your shoulder, your elbow, your wrist, or maybe even your knee, let's pretend that knee is a garden, right? You're working really, really hard to keep this garden full of fresh, fruits, vegetables, whatever it is that you're growing in there, right? So, a garden that's healthy is thriving, has got all this amazing vegetation. So, what is the one thing that you want to keep out of the garden? That's right. It's pests, right? It's rabbits and deer and squirrels and beetles, right? So let's pretend right now you've got this amazing garden. You want to keep the pests out because if the pests are in there, what are they doing? They're eating up the garden, right? So here's the analogy. Your garden, right? The garden is your joint, it's your knee, okay? The beetle, the pest that can get in there, well, that's arthritis. Okay. And so if arthritis is left in there, that just eats up the joint, right? That's kind of why you're in the situation that, well, not you, but that people are in that they're in. So when we do regenerative medicine, when we do stem cell therapy, we got to get the pest out of there first before we just put stem cell in there. And here's why. You know, if you want to help your garden recover from an infestation of beetles just eating away at the garden, you got two choices, right? If you want to get more vegetation back in your garden, you can either A, put just plant more seeds, try and grow more vegetation, or just throw a bunch of vegetables in there or whatever it is, right? That's one way to do it, right? The other way to do it, well, is to get rid of the beetle, right? Which one do you think makes more sense? That's right. Get rid of the beetle first, because if you're just throwing seeds and new vegetables and fruit in there, you're just feeding the beetles, right? You're feeding the arthritis. Same thing goes with regenerative medicine. If you've got arthritis going on in your joints, if you're just putting stem cell in there, yeah, you're going to help regenerate some tissue. But if you don't take care of the beetle, the arthritis, you're just feeding the arthritis. So that's why we take an approach that we do with A2M, the alpha 2 macroglobulin. This is the molecule that's found within your own blood that we take that extra step in the filtration process to isolate that molecule. And we then re inject that back into the person. And that literally gets in there and that finds the protease enzyme that is eating up the joint, that is the arthritic process. So the A2M kind of wraps around and engulfs that protease molecule, kind of like Pac-Man, right? And then shuttles it right out your bloodstream. So we do that first. We are getting rid of the beetle, right? The arthritis that is eating up the joint here. And then after about 3 weeks after it's had its time to do that, well, then we then go in and then we then administer the stem cell therapy and the injection into this joint where it can flourish and get the absolute best regenerative response possible and give the patient the best possible outcomes. So again, I'm Dr. Sanan Gutchman, and I hope that helps you better understand the A2M process that we do for our patients in our regenerative renew healing protocol.